Hi, my name is Judd, and I am a neuroendocrine cancer patient and advocate. I appreciate this opportunity to share a little bit about my NET journey with you and a few of the things that have helped me along the way. So, I was diagnosed with stage 4, grade 3 small bowel NET with mets to my mesentery and liver in September of 2022. That was after about a year or so of gradually worsening carcinoid syndrome symptoms and a number of dead ends in terms of trying to diagnose what was going on with me. But one of the things that's kind of unusual about my story from there is that I went almost immediately into a clinical trial. I enrolled in the NETTER-2 study and was assigned to the Lutathera branch. So starting about a month after my diagnosis, I started receiving PRRT. That went through the spring of 2023. I then went about 18 months just receiving octreotide LAR shots to help control my carcinoid symptoms. And then last fall in 2024, I had surgery to remove my tumors via resection and ablation. Fortunately, that was a successful surgery. And so now I'm basically tumor free for now and just really excited to have better health and spend more of my energy on patient education and advocacy. I was asked to address what matters most to me in my decision-making process in my NET journey, and there's a couple of things. One is information. For me, having as much information as I could about NETs, about how they work and treatment options was very reassuring to me. It helped me control my anxiety, and it empowered me to be an active participant with my NET care team in making decisions, including the decision to enroll right away in that clinical trial. Another thing that has been crucial for me along the way is having really a strong level of trust in my care team. I'm fortunate to have a wonderful NET specialist as my primary oncologist, and then my surgeon is also a NET specialist. And so between the two of them and the three of us really have had a robust, respectful, active listening type of conversations. And I think without that, I would have had a harder time making some of the decisions that I did, including the decision to have surgery, because at that time, my tumors were still stable and I was feeling pretty good. And I struggled a little bit with why would I have this surgery now? I believe I did make the right decision at the right time, but it was through information and trust in my team that I got there. One of the things that's really helped me along the way over the last 2 or 3 years is peer support. I have a wonderful family, wife and 3 kids and pets, but it was really meeting people in the NAN community as well as men with all sorts of cancer that has really helped me with my mental health and just weathering the ups and downs of the NET journey. I want to make a special plug for Man Up to Cancer, which is a nonprofit that is just men supporting other men through their cancer journeys. Men are very likely to have depression and shame and anxiety and to socially isolate with their cancer journeys. And Man Up to Cancer is all about changing that paradigm. One thing I would add as a lesson learned is to exercise or do whatever physical activity that you can. When I was undergoing PRT, I didn't really realize this, but I'm sure I was depressed and the fatigue just sort of led me into a funk as it relates to physical exercise. And I think that if I had really had a program of staying active to the best of my abilities, that would have been better for my mental and physical health. So I've really tried to pay attention to that more recently and won't be making the same mistake down the road. And then finally, I'm just really inspired as a NET patient and advocate by the constant advances in medical technology, medical research, and what it means for neuroendocrine cancer treatment. Receiving PRT as my first line of treatment made me kind of a nerd about nuclear medicine in particular, but I just really enjoy and get a lot of gratification from learning about these evolving treatment modalities and then sharing my knowledge with other NET and NEC patients. And finally, along those lines, I started a little Facebook group called Neuroendocrine Cancer Event Hub. That's really a master calendar of all the events that are being offered by NCF as well as other organizations for patient education. And I hope to grow that into a website in the future and to just keep sharing information to help all of us in the NET patient community be more confident and empowered in our care decisions. So I hope that was helpful, and I look forward to meeting some of you soon. Thank you.